Greetings, everyone. It gives me great pleasure to moderate today's critical discussion on lessons learned from the COVID-19 crisis for learners with disabilities. My name is Charlotte McLean Nhlapo, and I will be moderating today's seminar. I'm the World Bank's Global Disability Advisor and co-lead the Inclusive Education Initiative, which is a multi-donor trust fund overseen by the World Bank with support from the Norwegian Agency for Development Corporation, NORAD, and the UK government's Department of Development, DFID. The issues paper is going to be a discussion on global knowledge, and it's a product of the Inclusive Education Initiative. But before we start today's agenda and discussion, I would like to take a moment to recognize the process around developing this issues paper. It is a result of a very strong technical partnership between the World Bank's IEI team and disability inclusion experts and stakeholders from a range of sectors and from across the globe. The conceptualization and the writing of this paper has been extremely consultative, inviting perspectives from colleagues and organizations who are working on the front line of promoting equitable learning for all learners during the pandemic. In addition to this, the paper has definitely benefited from written contributions from representatives of organizations of persons with disabilities, from academia, from development partners, and of course, from our peer reviewers. Today's discussion is an important one. We see it not only as a platform to launch the paper, but really to address and discuss some of the issues that come out of the paper, pivoting to inclusion, lessons learned from COVID-19 pandemic. In addition, we see this as a unique opportunity to bring together experts from various sectors, such as education, social inclusion, social protection, health, and nutrition to discuss the topic at hand. It's even more important that we focus on children with disabilities and their families, particularly those that are living in poverty, those that face significant and multiple vulnerabilities during the pandemic. And these may be in relation to education, health, and/or social protection. So from an education point of view, there's growing apprehension that learners with disabilities are least likely to benefit from remote learning solutions, which have been rolled out in many countries as governments and educators attempt to keep the learners going. The learners with disabilities often lack the necessary assistive devices, internet connectivity, and often the available remote learning platforms such as digital or TV or radio are often not equipped with the necessary accessibility features and reasonable accommodations for learners with disabilities, and thus resulting in these children missing learning opportunities. From a social inclusion point of view, community services, programs serve to link people to provisioning of rehabilitation services and care, linking children to nutritious meals, and of course, linking to various WASH programs. During this time when schools are closed, parents are often experience increased financial stress. And this is often happening when social protection schemes are not providing adequately for the families, for the persons with disabilities, and in particular for children with disabilities. So we're learning from the research that this prolonged school closure in many areas may increase the likelihood of some children never returning back to school. And there's a growing concern that learners with disabilities might be disproportionately represented in this group of children that don't go back to school. And so with that, what I would like to do is to turn to today's run of show. We will start our discussion today with remarks from two global directors, and we're absolutely thrilled to have them join us today. We will start off with Louise Cord, who is the Global Director for Social Sustainability and Inclusion, that global practice, at the World Bank. And after Louise, I will invite Jaime Saavedra, who is the Global Director for Education, global practice, also at the World Bank. And then we will pivot to our excellent panel, who come from a range of disciplines, and they will provide some reflections on the issues paper, giving both a global and regional perspective. In terms of our panel, we will hear from Anna Diadio from the 2020 Global Education Monitoring Report, from Subeshka Karki from HI Nepal, from Fred Haga, who's from the Ministry of Education in Kenya, and also from Dr. Joseph Murray, who's presenting perspectives from organizations of persons with disabilities. So I'm sure you will all agree with me that we have an excellent panel ahead. And then we will close with a short set of comments from Anna Brixey, also from the World Bank, who leads the Human Capital Project. And so with that, let's get started. But before we do that, I would really request that you all post questions in the chat box. I will also request all of our panel members to only turn their audio and cameras on when they're speaking. So please mute your audio and turn off your cameras when you're not speaking. This is important because this will help us facilitate and enable all of our accessibility options, which will be needed during this seminar. So now, without further ado, let me give the floor to Louise, who will be followed by Jaime, and I'd like to invite them both to this event and thank them so much for their relentless leadership in promoting disability inclusive development. And with that, over to you, Louise.
Thank you so much, Charlotte. Good morning, everyone. And Charlotte in particular, thank you for your leadership and for your team's drive in organizing this important event to discuss inclusion of children with disabilities during the ongoing COVID-19 crisis and what can be done to ensure that they have access to learning opportunities. Including persons with disability and expanding opportunities are at the core of our work to build sustainable communities, and is completely aligned with the World Bank's objective of ending extreme poverty and promoting shared prosperity. In 2018, we announced our 10 commitments on disability inclusion to support countries to better invest in persons with disabilities. This includes a commitment to ensure that bank finance education projects are disability inclusive by 2025 and underpinned by our environmental and social framework. As we know, children with disabilities and their families are amongst the most vulnerable, facing multiple forms of exclusion linked to education, health, gender equity, and social factors. And those living in poverty are at further risk of marginalization. And we know too well that this gap has been further widened during this pandemic. Children with disabilities may have underlying health conditions that increase the risk of complications from COVID-19, or are disadvantaged at remote and distance learning when their regular programs are not available and accessible. Children with disabilities and their families can also be disproportionately impacted by disrupted home, community, and social care services that are so important for their well-being. The Inclusive Education Initiative, implemented jointly by the World Bank's Social Sustainability and Inclusion and Education Global Practices, recognizes these gaps and plays a critical role in supporting countries to promote better educational outcomes for children with disabilities. This initiative underscores the importance of highlighting disability inclusive education and the benefits of collaborative action between stakeholders working on disability inclusion, social development, and education. When we invest in learners with disabilities, we invest in a country's social and economic development. Being in school is not only about the education a child receives, but the entire social experience. It is about social interactions, emotional connections, accessing nutritional meals, and accessing WASH programs. For many learners with disabilities, it is where they have access to essential therapies, rehabilitative care, assistive devices, and technology. Right now, parents and caregivers are forced to play a dual role in their child's life, taking on the additional role of teaching. Often this requires parents to stop working or to reduce their workload to provide the necessary care and support, putting them under increased financial strain. And too often, we're seeing that social protection programs are not able to fully reach out to this group of vulnerable households to help them cope. Discussions on inclusive education have shown the need to draw on lessons learned from prior crises and ensure that they are implemented in planning for future events. For example, the Ebola crisis in Guinea, Liberia, and Sierra Leone led to school closures to prevent the spread of disease. But there is little documented evidence of disability inclusion in education during that time, affecting learners with disability over the long run. How do we change this outcome going forward? And what lessons have we learned from the COVID-19 crisis? Our new paper that we're launching today focuses exactly on these questions with the lens of social inclusion to education and makes a few key recommendations. Let me summarize 5 of them here. First, to ensure that essential social protection measures bolster security and access to health care and contribute to disability-related expenditures for children with disabilities and their families. 2, that we collect global, disaggregated data on disability to shape long-term inclusion systems going forward. 3, we build sustainable communities that focus on providing these critical care services to all families, including those with disabilities. And finally, create a lasting culture of inclusion. That means that everyone is brought around the table and that society supports inclusive development for all. Inclusive education is about creating an ecosystem approach, one that undertakes a holistic approach in supporting learning across home, school, and the community. Our hope is that we will be able to apply these lessons learned from COVID-19 to build truly inclusive education systems in the future. I'd really like to thank again the team that prepared this, Charlotte, and of course all our fantastic discussants who are joining us today for this conversation. And let me now welcome my colleague, Jaime Saavedra, who's the Global Director of Education, to say a few words. Thank you very much.
Great. Thank you very much, Louise. And thanks to all the team for organizing this. And I want to also congratulate the authors of this extremely important report for the which highlights, right, the challenges that learners with disabilities have been facing during this pandemic. Challenges that I extremely harsh. Now, let me start just by saying that before the pandemic, in most countries in the world, unfortunately, school was not yet the equalizing force that allowed everyone to have an equal chance in life. Many factors that should not matter for a quality education, unfortunately, still matter. Family income, access to books at home, the support of an educated caregiver, access to nutritious meals, all leave a mark on students' possibility of success. Having a disability also leaves a profoundly deep mark. There are close to 65 million primary and secondary school-age children with disabilities, and at least half of them are out of school. And not all of those who are in school are receiving the service that they need in order to have a successful education experience. Moreover, children with disabilities are 2.5 times more likely to never go to school than their peers. With the pandemic, the well-being and learning of all students is negatively impacted. I would say that it's dramatically negatively impacted. We see, and Luis mentioned some of those, There will be impact on nutrition, or there is being impact on nutrition today. There is the possibility of dropout from the school system, and we calculate that could be between 7 and 10 million children that will not go back to school. And we calculate that unless we do a tremendous effort in terms of remedial education and catch-up programs, this generation might be losing about $10 trillion on foregone earnings. $10 trillion is about 10% of global GDP. So it's a fantastically high number. And remember that this generation is the generation that will end up paying the debt that most countries are incurring in order to pay for the debt that to pay for this crisis. I just want to check that the video is on, because I keep receiving messages about that. Is that correct? Our video issues are fine?
It's fine, Jaime, I can see you.
Okay, great. Thank you very much, Charlotte. Now, so, I mean, in addition to the huge impacts that we have on children in general, the situation is even more dire for those with disabilities and or special diverse educational needs. The 2020 GEM report, for instance, estimates that 40% of disadvantaged learners in low and lower middle income countries have not received any support during this pandemic. We know for a fact that social distancing preventive measures have halted the delivery of critical face-to-face specialized services such as physical, speech, or behavioral therapy required by many children with disabilities. And that is something that has affected both developed and developing systems alike. Further, the economic recession that accompanies COVID-19 will likely lead to lower investments in education that disproportionately affect those with disabilities. For instance, families hit by the economic crisis might not be able to cover the additional costs associated with the extra support required by children with disabilities. However, I would just want to say that not everything is bad news. During the emergency, many governments have responded by providing multimodal distance learning, which means using radio, TV, printed materials, obviously online. I'm sorry? I'm sorry. What I was saying is that during the emergency, many governments have responded using multimodal or multi-platform strategies, using online, but using radio, TV, printed materials in order to reach as many learners as possible. Right? Obviously, most countries, if they would have relied only on online and digital tools, they would have reached a very small proportion of students. And these efforts of including TV and radio, for instance, implemented materials that were much needed by some learners have been created. For instance, radio offers the option of learning by hearing, which is useful for those with visual impairments. And we've seen that radio has exploded in terms of education programming in many countries. And TV with audio description and interpreters offers the option of learning for those with hearing disabilities. Now, this is obviously not enough, but it's a first step on the right direction. And we have seen more simultaneous sign language interpretation in TV media than ever before, right, in these crises, not in all countries. But for example, we have seen this in Georgia, in Kazakhstan, in Armenia, in Peru, in my country, in Rwanda. All of them have included sign language interpretation in their TV learning programming. Now, I want to finalize with a reflection in the sense that this pandemic has reminded us of at least three things that I want to mention. First is that we should design education interventions for those that are the most vulnerable. If a project and education system works for the most vulnerable, it will likely work for all. For instance, radio-based remote learning programs in countries like Sierra Leone, right? Reach both 32% of the most vulnerable and 86% of the richest. In contrast, if the program was computer or TV-based, it would reach less than 1% of the most vulnerable, surely deepen inequalities. Second, we need to internalize that nothing is for free. Giving the same opportunities, giving equal opportunities to everyone in terms of their education experience, it doesn't imply spending the same for everyone. Providing a good education for some children might be more expensive than providing the same good education for other children, and so be it, right? That is what we need to do. The same opportunity implies a different service and sometimes a more expensive service. But we need to build a social contract such that no children is denied from the right opportunity. Third, we cannot afford to have a parallel system. Normally, parallel systems that are not the same quality. But even if they have the same quality, having parallel system is not good for societies and countries, because when there are two systems, there is a system for the other, right? This makes a society having a concept of the other, and that is a problem. So we need to work always with integrated systems. And lastly, one thing that I want to mention is that inclusion is not about ignoring differences or eliminating differences. Those have to be preserved and maintained. And sometimes that makes the provision of education a bit more complex, yes. But that is complexity has to be faced. And it has to be faced because precisely that is what gives the education, makes education experience rich. At the bank, the issue of safe and inclusive schools, and inclusive in the sense of making sure that everyone has the right service, is one of the 5 pillars of our renewed World Bank education approach. So our education approach has 5 pillars. One is having prepared learners. Second is the pillar of teachers. Third is pedagogical interventions. Fourth is safe and inclusive schools. And fifth is management. So making the school inclusive is not like an additional characteristic of our education approach. It's not just one additional element. It's an integral part of the education approach of the bank. As part of the 10 commitments that Luis was mentioning on disability inclusion, the World Bank has committed to ensuring that all of its education projects and programs will be disability inclusive by 2025. And since correctly including children with disabilities in the school system is not easy for teachers, policymakers, and our teams, we have developed guidance notes and support also for our staff, right? We all need to internalize that this is a challenge that has to be mainstreamed. We want our operations to solve the relatively easy problems, like making sure all kids who need glasses have them, but also address challenges within communities, like making sure that parents never hide a child with a disability, and the acceptance by all children that differences are a source of riches, and also the more complex problems, right, of building inclusive education systems, which does not happen overnight. So I want to thank the organizers of this event, and also welcome the discussion around this paper that actually is a starting point, I would say, right, of a journey that I will have to continue, both in terms of giving children with any type of disabilities the service they deserve, not only during this pandemic, but in education systems that are more equitable, right, and more inclusive. Thank you very much.
Thank you very much. Thank you both, Luis and Jaime, for those extremely pointed remarks. I think it's critical for us to remember that education and school is not just about the education that the child receives, but it's really about the entire social experience. And I think I'd just like to emphasize Jaime's point around building a social contract to ensure that all children have access, and therefore requiring us to invest in that. So thank you both very much for excellent remarks. I would now like to turn to our panel, who will be presenting their reflections on the topic paper and making some and on its recommendations. I would first like to invite Anna Diadio. Anna is an economist by background and a senior policy analyst with the GEM report team at UNESCO. She was very involved in the 2020 GEM report on inclusion and education, and was in fact the principal author of the COVID-19 section of the paper of the GEM report. So we're really happy to have her. So I'd like to hand over to Anna.
Thanks a lot, Charlotte, and thanks really for having me here. It's a very important and it's a real pleasure to be here with you. And in fact, my reflection would be really on the link between the issue papers and the recently released JAM report on inclusion in education, and particularly with, as you just said, on COVID-19. And but first, let me really say that I am delighted to join today's global seminar, which continues a very fruitful collaboration between the JAM report and the World Bank on the theme of inclusion and education, which is the focus of our discussion this morning. There are multiple connections between the issue paper just published and the 2020 Global Education Monitoring Report on inclusion in education, both on the overall issue of inclusion and on the effects of the COVID-19 pandemic on education. The first interlinkage I would like to highlight summarizes really one of the main message and overarching recommendation of the JAM report, namely ensuring that mainstream education is universally designed for learners, or in other words, that is designed for all learners. However, there are differences between the two reports in the sense that the issue paper focuses on a particular group, that is mainly children with disabilities, while the JAM report looks at all groups that can be at disadvantage and marginalized in and through education, and adopts a comprehensive definition of inclusion that can be used for all groups without distinction. Despite that, both reports define inclusion in education as a process that allows to respond to the needs of all learners, including those with disability then. And this is also specified as a main message of the issue paper. But talking about people with disability, the issue paper also highlights the twin track approach that emphasizes that it is not only critical to ensure mainstream education is designed for all, it underscores that it is necessary to develop targeted support to address the specific needs of children with disabilities. Once a system is structured and designed to respond to the needs of all learners, there will be less need for targeted support. However, as the JAM report 2020 highlights, we are very far from this ideal in many countries, be they low or high income. In 2020, 258 million of children, youth, and adolescents were completely left out of education. In 12 countries, children with disabilities are 2.5 times more likely never to go to school than their peers. And we know that there are many other factors that risk to exclude also many students, and especially those with disabilities, when they are in the classroom. Overall, in fact, there are many factors that aggravate the risk of exclusion from within education. Emergencies and crises are potent risk multipliers for those most at risk. And especially as the current pandemic has shown for children with disabilities. The COVID-19 pandemic has shown that many learners have been completely left without education, and children with disability, as we already heard, have been among those. And the questionnaire by UNESCO, UNICEF, and the World Bank has shown that 40% of countries have not addressed the needs of groups of those most in need, including those with disability. The JAM report also shows that exclusion and segregation are still widespread for people with disability. This appears, as highlighted also in the issue paper, under the form of insufficient resources that can instead help to address individual needs, the lack of application of universal design, the lack of insufficient training of teachers. The 2020 report, JAM report, shows that around a quarter of teachers in middle and high income countries reported a high needs for professional development on teaching students with special needs. The finding of the issue paper reiterates this message, that teachers do not have the support and training needed to respond to the needs of all learners. The World Bank study shows that in the wake of the COVID-19 pandemic, 33% of teachers in North America and 41% of teachers in sub-Saharan Africa reported a need for greater training for inclusion. Both reports, while addressing the importance of remote learning, highlights that this is not enough and can instead contribute in many cases to deepen inequality. In many low-income countries, internet connection is neither available nor enough developed. Teachers were not prepared to the paradigm shift, and low technology-based connection were also not readily available. More particularly for people with disability, technologies and learning materials used during pandemic often did not meet their needs, something that is also highlighted by the issue paper. The GEM report and the issue paper both reach the same conclusion concerning the needs to use the best available data on children with disabilities. That data need to capture children with disability, which is critical for designing and planning education programs and emergency activities. Furthermore, the theme of multi-sectoral coordination and collaboration, as we just heard, is also central in both reports, highlighting that inclusion requires a holistic approach with different sectors working together to reach the same objective, allowing a quality education for all. School closures have meant more risk to be left behind, especially for the poorest. This has also meant, for example, no access to school meals. Intersectionality and compounding of vulnerabilities are also core issues discussed in both reports.
And Anna, can I please ask you to wrap up?
Yeah, and there are many more examples of interconnection between the two reports, with messages that reflect the conviction that the discussion of inclusion is not also timely, but is also core to build more inclusive society. And let me say that before concluding that really we look forward to deepening discussion on the intersecting findings and recommendation of both reports and national and regional dialogues over the coming months.
Thank you so much, Anna, for those remarks. And thank you for emphasizing the important role of teachers and drawing out the parallels between the GEM report and the issues papers. Thank you so much. I'd like to now pivot to our colleague from Nepal, Shubeshka. Shubeshka is an inclusive education technical advisor with HI in Nepal and has for the past 7 years been working in the education sector in close collaboration with government and various working groups. She works closely with civil society and has a specific focus on children with disabilities. Over to you, Shubeshka. Please, can you keep to the time?
Thank you for providing an opportunity. At first, I'm going to share about Nepal's response to learners with disabilities when schools are closed. So Nepal had lockdown from March 23rd, which was lifted last week. However, the education institution are still closed in Nepal. So government of Nepal is putting in place a series of measures to address the situation. They have formed a committee to coordinate the preparedness and the response effort. So under education cluster, government in Nepal has developed contingency and response plan with the objective to prevent the spread of COVID-19 from education institution by ensuring a safe learning environment. Within that contingency plan, there is a specific focus on children with disabilities. For example, print and disseminate disability inclusive learning pack. Public service announcement, that is PSA, were also prepared and disseminated, focusing on providing importance of learning for children with disabilities with sign language interpretations. Currently, the content of on mapping of online print-based learning materials for children with disabilities has been developed, and this mapping exercise will allow government to know the existing learning materials and identify the gaps so that the new materials could be developed based on those gaps. And then currently government of Nepal is also providing learning through an alternative education system, including distance and open education. So basically lessons are delivered through radio and television. Also, government of Nepal, Ministry of Education, Science and Technology has developed a learning portal which contains digital content such as interactive learning games, video of classroom lesson, audiobooks, as well as books in digital format. However, the content on the learning portal that is online are not accessible for children with disabilities currently. So in terms of providing a way forward for ensuring inclusion of learning with disability, it is really helpful to have issue papers as it provide a way forward, as well as provide a specific recommendation based on case study of what is actually happening. So concept like applying universal design for learning principle, designing an inclusive enrollment campaign would be very effective in planning during and post COVID-19 situation. As here in the issue paper while planning, it is best to focus on the mixed approach of interventions. As per contingency plan of Nepal, it is estimated that only 35% of students have access to media, such as radio or TV. Thus, we are using different modes to ensure that children with disabilities are accessing and continuing their learning. For example, Ministry of Education has already developed the textbook from grade 1 to 10 in Braille. So they are like children are accessible to those learning material, to those textbooks while listening to the radio lesson. Not only this, they are also mobilizing the resource class teachers and assessment center coordinator who are basically assigned to provide the support to children with disabilities, to provide guidance and track whether children with disabilities have access to learning or not. Similarly, HR Nepal are also supporting radio initiative at community level so that children with disabilities are supported to follow the radio content. In terms of providing a way forward for ensuring teachers are prepared to engage with their students with disabilities in a more inclusive manner, in Nepal, while implementing an inclusive education program, we ensure that the materials, guidelines benefit all children, not just children with disabilities. Currently, Ministry of Education is providing a training, they are providing a training from the Teaching Department on teachers on technological interference. For example, on the early grade reading program focusing on children with disabilities, we are also providing training on early grade reading to teacher focusing on reading instructional, developing the individualized education plan, teaching learning materials, etc. So this teacher will use the knowledge gained in the classroom once the schools are reopened. It is crucially important that family and community are engaged in the process of learning during the period of school closure, not only just to support the child ongoing learning, but also prevent later dropout. As we all know that children with disabilities are more vulnerable to dropping out of schools after a long period of absence. So in terms of Nepal, through community-based rehabilitation centers and through the community volunteer, we are ensuring that all those community volunteers are well placed to work with individual family on learning support. For example, in a project supported by HI in Nepal, community mobilizer are trained in supporting children with disabilities and their learning needs, provide remote support by holding weekly meetings through like virtual meetings and telephone conversation with local volunteers based in community who can carry out the regular home visits at a very safe distance, maintaining a distance, and then report back to get further advice and support. When the restriction is eased and when the movement are allowed, we are also thinking to have a face-to-face meetings, and teams are also looking forward at how to support parents to take part in more into educational games such as picture, word matching games, developing visual timetable, tactile alphabet, and so on. So thank you for listening. This is from my side. Thanks a lot.
Thank you so much, Shubeshka, for your very useful remarks and giving us some insights in terms of what's happening at country level. We really appreciate them. I'd like to now turn and invite Fred Haga. Fred is the Director for Special Needs Education in the Ministry of Education in Kenya. And Fred will provide us with some insights on the experience of adapting distance learning in Kenya, particularly for learners with disabilities in response to COVID-19. And maybe some reflections from you, Fred, on the usefulness of the issues paper that we're discussing today. So over to you, Fred.
Thank you, Charlotte, and thank you to all the organizers for having me today. The issues paper and the GEM report are very appropriate, especially to the situation that we find ourselves in Kenya. Like many countries, Kenya closed its schools in mid-March. More than 15 million learners are at home, not going to school at the moment. And Kenya embarked on this path of inclusive education in its latest planning documents and its latest policy. And if ever there was a reason to fully embrace inclusive education in our planning and implementation, then for those who still had any doubts, COVID-19 has given us a very defining example, a demonstration of this. This is because in the planning and design of our education programs, we had started as a country developing accessible material based on the universal design of learning. And one such initiative developed accessible books, and then COVID-19 happened. So we have established that some learners are able to access this book, which is uploaded onto the Education Cloud by one of the ministry's agencies, the Kenya Institute of Curriculum Development. And although not all children with disabilities are able to access material like that accessible digital textbook, those who have devices are able to access it. So the ministry mounted remote learning platforms, that's radio, TV, and online learning. And like I've already observed, not all children with disabilities are able to access this. And therefore, my focus, the rest, I'll focus on some of the key lessons that as a country we have learned through the experience of the COVID-19 pandemic, so that moving forward, even as I reflect on the report and the issue paper, there are things that we need to think about in order to make sure that no learner with disability is left behind at all in education. And the first lesson that we have learned as a country is that for far too long, the approach we've had towards service delivery focuses more on the school and not so much on the individual child. For that reason, many of the projects or programs that we are implementing seek to provide resources to schools, to make schools accessible, put teachers with right qualifications in school, because the understanding is that when the children are in school, they are going to access these resources, these devices, and all that. One clear example is a computer program we have called the Digital Learning Program. And that program provided assistive devices, accessible laptops and learning devices to the schools. So these are locked up in schools. The children do not go with them home. I think we now know that when we are seeking to really include children with disabilities, this needs to shift so that the focus is not so much the school, but it reaches the individual children. Because with those devices, if the children were going home with them, then they would be able to continue learning even when they're at home because of having those devices. Unfortunately, now in most of the schools, the devices are locked up. The second lesson that we have learned, and this is also very relevant to the issue paper, I think already talked about the universal design of learning, but it is time that we started looking at families in a different way. I think in the past, we've been happy to involve families and parents in the education of their children through getting them to know what is happening, receiving reports. But we have now learned that families can also be a focal point of learning for the children. The parents or the siblings do not necessarily have to go to teaching college, but they are important parts of the curriculum that can be well implemented at home. That can only happen if the families get to know what is required of them. In the Kenyan curriculum, there are some practical tasks, including cooking, cleaning, grooming, and in the rural areas, agricultural production that would have continued very well if the school system or the education sector had engaged families, let them know the requirements of the curriculum and the role that they can play, so that those learners with different disabilities, even those who require one-on-one instructions, and still use the time when they're at home in terms of to learn different things, and therefore they wouldn't be as idle as some of them we believe are at the moment.
Fred, this is Charlotte. I'm going to ask you to wrap up in a minute, please.
That's right, Charlotte. Finally, the issue of services being focused to school, and here I'm talking about services like therapy. We have had reports that many of our children who are now at home are not really receiving the appropriate therapy that they need, because most of this has been focusing on school. So I think those are some reflections that we need to think about, and lessons that we have learned as a country in terms of the COVID-19 experience.
Thank you very much, Fred, for sharing some perspectives and insights from Kenya, for emphasizing the importance of following the child and the importance of family. I'd like to now invite Dr. Joseph Murray. Joseph is the president of the World Federation of the Deaf, and he has worked for more than 2 decades to advance the rights of deaf people. But he was also very instrumental in writing and negotiating the latest report from the International Disability Alliance on inclusive education. So over to you, Joseph, great to have you.
Thank you. Can everybody hear me, interpreter? Yeah. Thank you for having me here. So, I'm the Dr. President Joseph, the World Board member of IDA, and for Inclusive Education of Disabilities Alliance. That is part of IDA. That is also part of the United Kingdom's Department for International Development. And the IDA recently released an Inclusive Education Global Report, which outlines the conditions required to build inclusive education, and this systems geared towards providing quality education to all children, the youth equitably. And we have at least 10 recommendations from the government to civil society that IDA deems essential and urgent for the implementation of inclusive education of all learners, including children and youth with disabilities. Learners with disabilities also often struggle to get equitable access to education, even during the regular school year. About 50% of children with disabilities in low and middle income countries were out of school even before this pandemic happened. And so the COVID-19 pandemic has highlighted these disparities that as we all struggle to move education to other modalities and continue to ensure the safety and equitable access to education for all children. During the pandemic, we see education shifting to remote learning, online learning, both in synchronous and asynchronous formats. The presence of some challenges, but also some opportunities that I will briefly discuss on both. The challenges with remote online learning include ensuring platforms are accessible to all learners as well as adaptable to different learners. This means all platforms should be built in accordance with principles of universal design for learning and should also be multifunctional, like multiple options for different learners, because there is likely no single format or medium that is accessible to all learners. For example, if teaching happens via radio transmission, and there must be equal opportunities for learners who are deaf and hard of hearing to access the same educational content in their national sign languages. Learners with intellectual disabilities must have access to content that is relevant to them and be provided with materials for their caregivers. The government may want to ensure some specialty services for learners with disabilities, which are contingent on in-person learning, should be seen as critical infrastructure and continue to remain open with the appropriate health measures to put in place. And we should not be aiming for a quick fix solution. We should be aiming for higher. We should be building models of distance education that will last. For fully inclusive distant education that will last beyond this immediate crisis. The models we create today would better be adopted in different emergencies going forward, whether it be in the health systems, be successfully waived in the COVID-19 with other humanitarian assistance situations such as natural disasters. This call for the flexibility and adaptable learning means government and other educational stakeholders should not process with hasty band-aids, but should invest in ensuring multifunctional platforms in consultation with organizations of peoples with disabilities. The current renewed investment in online learning and remote learning platforms present us with an opportunity to include learners going forward. All funding towards distance learning must include disability inclusion as a mandatory criteria for funding. Whether it be gender, the disability, or other kind of marginalization group, we all want them to be included. Of access this once we design for all, we ultimately end up including those who have been excluded from education. As COVID-19 pandemic went global in my capacity as president of the World Federation of the Deaf, I met with our national members, national associations of deaf people in about 25 countries to learn about the national level response to COVID-19. What we found was these national deaf associations are often the front line of these providing critical support to the public and to the government. These organizations were providing access to information in national sign languages, serving as expert advisors, educators, and families of deaf children on equitable and accessible education and assisting governments with the COVID-19 response and outreach efforts, including food distribution. Which is the same with true of the organizations of true with people with disabilities. What tells us some we already know, nothing about us without us. Most marginalized groups have experienced these oppressions of not inclusion. What it tells us is something that we already know, nothing
Joseph, thank you very, very much.
Hold on, it was we. And thank you for inviting me here into this panel. Really appreciate it.
No, I want to thank you. Thank you very, very much. I know there've been a couple of hiccups, but we do appreciate your patience with us getting this sorted out. So I'd like to thank Joseph for actually raising an issue that we often forget about when we talk about inclusive education and learners with disabilities, and that's the issue around the importance of ensuring that children with intellectual disabilities are included. So thank you for bringing that to the stage and to our attention. It's important for us to keep that at the fore of our thinking. So now we'd like to move into a session of Q&A. And we have several questions coming in through various media channels, some of our social media channels. But we also very fortunate to have the core members of the writing team that developed this issues paper. And so I will lean on them to provide some subject matter expertise as the questions come in. But let me start with one of the first questions that I've received. And it's the question, and I'll read that. It says, what role can the global tech industry play in supporting remote learning for learners with disabilities? And then the second question is, what are the World Bank and developing countries doing to ensure stable, affordable, easily accessible internet connectivity in the developing world as a means of improving accessibility to digital learning during crises like this one? So I'm going to ask if maybe Jaime could speak to those questions. Okay, let's wait and maybe Jaime is trying to connect. Perhaps we can go to another question. We've received another question that says, which countries does the World Bank plan to implement the IEI in? And are there other international organizations going to partner with the World Bank for this initiative? And perhaps for this question, I might want to ask Ruchi Singh to respond.
Thanks, Charlotte. Great, thanks. That's a great question. And I think to respond to that, the Inclusive Education Initiative is partnering with countries, Rwanda, Ethiopia, and Nepal. We are working with our World Bank colleagues there in those 3 countries, as well as with several development country partners there. And the Inclusive Education Initiative also is partnering with other international organizations like UNICEF to really work on promotion of the huge gap of data, availability of data, and disaggregated data in disability. I'll stop there. Thanks.
Thank you very much, Ruchi. I have another question that says, how can lessons learned from the COVID-19 crisis and the risks faced by children with multiple disabilities lead to strategies for ongoing teacher training to support their work in providing quality inclusive education to all children, including those with disabilities? And perhaps for that one, I will ask Nidhi Singhal to respond, as she was the principal author for that section. Nidhi, over to you.
I think that's a fantastic question. We need to acknowledge that teachers are central in any efforts which are made to include children with disabilities at the time of COVID-19. We have seen some really interesting strategies in various countries. In the issues paper, we highlight that. We talk about teacher training and CPD efforts in Rwanda, in Nepal, etc. I think absolutely essential to acknowledge that while we're thinking of level platforms, technology, etc. The interface between the teacher, the technology, and child is really central. And I think while efforts are being made, we need to gear them up further. And I'll stop there.
Thank you very much, Nidhi. There's another question that speaks to how do we keep safe children who are largely touch learners getting infected, as well as those with social, emotional, and behavioral difficulties and sensorial issues, those children who have challenges processing information. I'm going to open up to the core group, but maybe I'm thinking Nafisa Babu.
And Charlotte, let me. I think I have my video on, but I
Yes,
still
you
keep
do.
messages saying that I'm not. But I mean, at some point I can jump in.
Great. Okay, we're waiting for Nafisa, but Jaime, maybe I can ask you to respond to, there was a question around what the role of global tech is and how we can provide a supporting role in remote learning for learners with disabilities. And then a similar question around how do we ensure more easily accessible internet connectivity in the developing world, and looking at digital learning in that regard during the crisis. So if you could maybe address that, that would be great.
Mm-hmm.
Thank you.
No, so thank you very much for those points. Yeah, I heard them before, so but I couldn't connect. So look, technology can be a game changer, right? For instance, there is available technology which convert text to audio or braille characters, therefore allowing students with print disabilities, right, to use online study materials in different formats. So technology is an opportunity. However, the challenge sometimes is not having the right software or the digital device. The huge challenge that we have is on how to create the right ecosystem in which we have the device, we have the right software, but also we have the right teachers or other type of support in order to use that effectively. So one challenge that that we have in many cases is that we have one of the pieces, right? Or we, and sometimes countries makes the effort to buy the devices, or maybe have a pilot program with the right digital tool, and that is fine, but it's not enough, right? The key challenge is to put all those elements at the same time. And similarly, and going to your second question, I mean, a huge challenge for us is how to expand connectivity. This pandemic has, I think, shown us as a critical lesson that there is a huge digital divide. Unfortunately, in a way, it's like saying, look, there was a digital divide. You knew there was a digital divide. Countries didn't act upon that, right? And now we see the consequences of that digital divide, right? If that digital would have been closed or would have been in the path to closing, then it would have been much easier to reach many children, and also children with disabilities. So so we really need to embark on that in a much more forceful and accelerated way. And it's not only about connectivity. Of course, connectivity is critical, but it's about the hardware part, right? In terms of having an internet connection. Satellites are each time more affordable, but that's again, that's not enough. Just having the school connected will not imply any further learning, right? If there is we don't have the ecosystem as a whole. So actually the work, and actually we're starting working much more closer, particularly with UNICEF, is to bring the whole package, right? Is the package of connectivity plus the whole ecosystem that is needed, both within the whole education system, but also to have the right tools at the school level, including the training that is needed for teachers. Now this requires a lot of commitment of countries, We do see that there is an interest always to do that, but not necessarily with the level of resources that are needed in order to cover all the population with disabilities. So it's an issue there of intensity of the effort, right? It's not that countries are not interested. Most countries will be interested, right? The question is if there are the resources in order to push much further so that we include all children that needs additional support.
Thank you so much, Jaime, for those responses. I know Nafisa was trying to connect, but I'm going to ask Julia. She might want to come in and speak to the issue around children with behavioral difficulties. And while you're on the floor, Julia, maybe you could speak a bit about a question that came across around how, the fact that the COVID-19 crisis has been very bad for refugee children. And is there a way that we can build off of access to education for children with disabilities and ensure that refugee children also receive the same services? And I think that's to a point that Jaime made earlier on, that if we design in a particular way, we design for everybody. So over to you, Julia.
Absolutely. Thanks, Charlotte. Yeah, on the first point, I think, just one thing to mention, obviously, and I'm glad it was brought up actually, because sometimes children with behavioral difficulties, emotional challenges, and also intellectual disabilities are forgotten about within the wider group of children with disabilities. And it's particularly challenging right now in terms of the routine and the structure completely changing. During this time of COVID, everything's completely changed. So particularly for those children who do need structure and routine within their lives, they need some support in order to understand what's happening. And many of the messages that are going out around, what to do in terms of social distancing, in terms of hygiene, and in terms of what's happening, aren't always accessible to those children. So really tangible things are making sure that information can be done in picture format, easy to understand, very child friendly, and that also that there's a real focus on community level support. So going back to that idea that, let's work together with existing community health workers, other workers who already know families at community level, and support them in terms of the additional information they need to go to their homes, if they are still able to go into homes, to be able to give that proper information and give advice to how to support learning at home, etc., in a way that is, accessible. So examples being the public service announcement that was mentioned earlier in Nepal, gave some tips about home learning and how to do structured routines for children at home, with a visual timetable, for example. Those kind of simple ideas can really help. And then in terms of your other question, Charlotte, around the refugee situation, of course, it's very challenging. It's just an additional challenge on top of the existing difficult situation that many of those children face. Actually, we've seen some really nice innovations in a way. I think sometimes in really challenging situations, people can really defy what expectations in what they can come up with. So despite the difficult challenges, I know that there's various camps, for example, in Kakuma camp in Kenya. I know that they really are making an effort to try and reach children who are now out of school. Of course, all the schools and learning centres are all closed, as they are across the country. But they're trying to sort of repurpose, in a way, people who were supporting at school to the home environment. So sometimes it's around learning, in a way, cross-learning from what's happening in camps, as well as what's happening in the mainstream education sectors outside in the host communities and elsewhere. Sometimes there's a bit of a siloed approach, in terms of what goes on in refugee camps and maybe host communities, and what goes on outside of those situations. So maybe this, going back to the theme, this could be an opportunity to really kind of link together initiatives that are taking place across both refugee camps and host communities and the other areas within a country, because sometimes they're not always interlinked, really. And I think at policy level, it's just crucial that anything that's written in to what the country strategy should be in terms of inclusion and inclusive education should also be within whatever's written about the refugee population. And sometimes inclusive education for children with disabilities is missed off, you know, that agenda. It's really crucial that the two are aligned. That's probably enough from me.
No, thank you very much, Julia. And I think, I think creating those platforms and spaces where these different groups that work either on children with disabilities or refugee children is really important, so that there is that cross-pollination and then that discussion around how you can actually expand services to all. So thank you very much for those comments. We have a really great comment, a question rather, on are there any specific recommendations we have to ensure that preschools are more inclusive during this time of COVID-19? And for this one, I'm going to try to go to Nafisa and hope that she can hear us. Nafisa?
Thanks, Charlotte. Yes, preschools play a really important role also for frontline workers and for who have children with disabilities, where they can have them, where they can get care and also their learning stimulation, some learning stimulation. I think it's really important now that we start that practitioners and ECD centers also learn about how to ensure proper social distancing and hygiene measures in the classroom, and encourage children to take ownership of their own health by using sanitizer and hand washing more frequently. So I mean, those are one of the key things that we need to emphasize in that age group also. And I think it's also a really great opportunity to practice some of the universal design for learning principles, which are so easily available through play, right? And I know that at my daughter's school, they've only taken certain toys out that were for groups of children, and made sure that small groups of children work together. They also clean the toys quite regularly and encourage a lot of imaginative play as well, and I think that these are just a few strategies that they could employ in the classroom. I think she has butterfly wings, and you're not supposed to let other children's butterfly wings touch another child's butterfly wings. And I thought it was a really nice way for them to kind of get a sense of the space and using their bodies as well. You know, in that early ECD phase, I think the involvement with the parent and making sure that they also understand good strategies to promote inclusion is important through play and everyday activities and making it fun. And luckily in that age group, just talking to your child, reading stories and engaging them in everyday activities, but making it fun is really helpful. So yes, preschool teachers can it's a really great opportunity now to practice more inclusion and help children support one another through play.
Thank you very much, Nafisa, and thanks for sharing with us a real life example by way of your daughter. It's great to hear that. We have a question around high quality open educational resources available to support educational systems, capacity building, and teacher professional development in universal design for learning. And I'm going to ask Anne Hayes to speak to that question, the whole issue around universal design for learning and how we can use that more efficiently and effectively. Anne, over to you, please.
And if I can come back later, Charlotte will appreciate.
Absolutely. Anne?
Yes, I think UDL and introducing UDL in low resource settings is still very new, and we're still trying to obtain information on what's working and what doesn't work. And I do think as we look at COVID, using a UDL framework is even more important, because very few children can sit in front of a radio and listen, or sit in front of a TV. So putting into those things within the curriculum to get the children moving, to be working with materials, to be interactive, is more key. Unfortunately, because this is a newer emergent area, a lot of the UDL resources in professional learning are really based in high income. So this shows another need for how do we integrate this into pre-service and in-service throughout many countries, as well as design UDL frameworks that are respondent to their context. So there's a strong need to take some of these universal design for learning practices and adapt them. But there's still a large dearth of information and how we can build that in low resource settings.
Thank you so much. Jaime, over to you.
Great. Great. Thank you very much, Charlotte. I wanted to make 2 points. One is that regarding, first of all, is that with this pandemic, and that's one of the a positive consequence of a huge crisis that we're living in, is that some governments are investing more in personalized and individualized pedagogies, particularly for when school open, right? So a lot of investment using artificial intelligence or machine learning, which is now much more ready available to teach at the right level, right? So make sure that each one of the students have the support and the type of difficulty in the specific learning in either reading or math, depending on where he or she is. And given the fact that the huge unequal access to remote education programs during these school closures, we know that when students go back to school, they will be at very, very different levels, right? Even before there was heterogeneity within a classroom, now that heterogeneity in terms of the type and level of stimulation that each child needs will be even larger, right? Even larger inequalities. Now that happens always, right? But now we're investing in that type of software that can make easier the job of the teacher, and actually is a type of investment that can also help a lot with children, for instance, who have mild intellectual disabilities, right? And that's something that should be part of our regular battery of tools, these individualized pedagogies. But now it's something that probably we're going to see a faster adoption in many education systems. Obviously, that will require a lot of investment in teachers, so that they will be able to use those technologies in the right way. And the second point that I wanted to make, that is something that Julia mentioned, is the issue of the continuity of learning between the school and the home, right? What we'll need to build in terms of the school of the future that we aspire to, which is a future that is now in the coming months and years, a future that has been propelled to today because of the crisis. In that school of the future, we need to have much more resiliency, right? And a school that is resilient is that it provides a continuous learning opportunity between the school and the home. That implies investing in a different way with teachers, but also implies investing in having the conditions at home for that learning to continue. Implies support to parents, implies trying to invest in children having the right device or whatever device they need, and to put the conditions at home for learning to happen, which could be high-tech stuff, but it could be very low-tech stuff as well, right? We have a program called Read at Home that is about putting books in the hands of children, right? I mean, and even though in the more developed systems, I mean, with all the technology, books are still critical, right? So we need to make sure that even in poorer households, there is reading material for kids. So our approach is now, in order to move to that resilient school system where there is a continuity in the learning process between the school itself, between the building and the and home, which implies a lot of work with the community as well. But that's the way we see it as a critical characteristic of the school that we aspire.
No, thank you for those very encouraging words, Jaime. So we have a question related to what kind of an approach should be used for teacher training in looking at training around UDL and sign language interpretation. And we know that this is often an issue that comes up where there's a lack of sign language interpreters. And I'm going to ask Joseph. Joe, maybe you could answer this question.
I appreciate the question very much. Absolutely, this is needed. In order to be ready for the students to learn, students with disabilities to learn, they have to have access to the information, and sign language for deaf students is crucially important. It has to be people that are fully qualified in that language, the sign language of that country, in order to truly improve the possible outcomes for the students, for the deaf students, deaf or hard of hearing students. They have to have a language-rich environment as well. Universal design is about ensuring also that all the staff that work with the students also have that particular training and are able to work with them. When we talk about sign language education, it isn't only sign language interpreters, which is very important. We also need to talk about the recognition of that sign language in that country. So when, especially now during the pandemic, when we look, we are analyzing what the staff skills are and how we can improve every part of the whole program for the students with disability, for deaf and hard of hearing students. Thank you.
No, thank you very much. Thank you so much for your response. We're still receiving a fair number of questions, and so what I think we should do, just as a matter of saving the time, is that we will make sure that we include all the questions in the Inclusive Education Initiative's community of practice. We can keep that as an ongoing place where we can respond to some of the questions. But I am mindful of the time. And so now I would like to invite Hannah Brixey to make some comments. As I noted in the beginning, Hannah leads the Human Capital Project at the World Bank. Over to you, Hannah.
Thank you so much, Charlotte, and thank you, organizers, for this excellent opportunity to discuss the needs of persons with disability, and specifically also for your invitation to tell you about the Human Capital Project in connection to persons with disability. So the Human Capital Project is a global initiative to protect and invest in people. It involves knowledge sharing, partnerships, and also financial supports to countries to prioritize investments in health, education, and social protection, and other essential services, including water, sanitation, and so on, to ensure that children are well-nourished, ready to learn, and that they can enter the job market and engage in their community as productive adults. Now, the Human Capital Project is informed by the Human Capital Index, and that is a measure that asks how much human capital can a child born today expect to acquire by age 18, given the risks of poor health and poor education that prevail in the country where she lives. And this Human Capital Index, with its 2020 update forthcoming next September, creates a momentum for action. So addressing the needs of persons with disability during shocks, such as the current pandemic, is essential, as it has been discussed in this roundtable. And let me give you two examples from the Human Capital Project angle. One is the Integrated Policy Response Package that has been issued, prioritizes protecting people with emphasis on vulnerable people, including persons with disabilities. And it advocates for a whole range for an integrated package of services, including community services, food supplies, and services, including continuing learning for children in needs. Now, in response to COVID-19, the World Bank operations, for example, in Ukraine, Bolivia, and San Martin, are directly supporting people with disabilities with direct cash grants to maintain living standards and maintain the capacity in households to nourish and promote learning of children. These projects also directly support persons with disabilities through temporary expansion of program eligibility, and they support also civil society organizations representing persons with disability. Now, going forward, the Human Capital Project contributes to building back better strategies and with emphasis on improving the service delivery systems, making these systems more resilient, making them stronger to ensure universal access and good quality of services for all citizens, for all people, and especially for people in poverty, vulnerability, and persons with disabilities. And importantly, also to provide voice to these to persons with disabilities. And in this context, let me highlight that the Human Capital Projects promotes a whole of society approach, which involves multiple actors, government, communities, civil society organizations, and the private sector, to protect and invest in people and to ensure universal access, service quality, and voice for all, and especially persons with disability. And finally, our recent joint brief on human capital and disabilities outlines the rationale for and the approaches to addressing needs of persons with disabilities in the context of human capital development. So it demonstrates that there is a strong commitment in the Human Capital Project to anchor the needs of persons in disabilities. And we very much will welcome comments and look forward to further collaboration. Thank you, Charlotte, and back to you.
Thanks, Hannah. Thank you very much. And it's been wonderful working with your team in developing that brief. It's really a great new addition to the suite of knowledge that the bank is building around disability inclusion. So thank you very much. So going forward, we want to make sure that we keep this engagement going, the conversation going. And so what we will be doing in the next few weeks and months is to have regional seminars on the issues paper. And I'm sure many of you will be either directly involved or engaged in some way or the other. We really want to ensure that we have more in-depth contextual dialogues around the issues of learners with disabilities and COVID-19, and really speak and hear from local stakeholders and then find out how this paper can be used to guide their responses. We see this issues paper as a living document, and so we'll continue to upgrade it as we learn more. We're all learning more and more about the COVID-19 pandemic every day, and so we feel that the paper itself should also be alive. So please, as I mentioned earlier on, join out the Inclusive Education Initiatives Community of Practice. We will have a lot more materials there and have continued engagement. So with this, I would like to thank everybody who's attended today's seminar. But before you all go, I'd like to close by sharing with you a very short PSA that was developed by the disability inclusion team within the bank. And we want to introduce you to a young girl with a disability. Her name is Josie. She comes all the way from South Africa. So let's hear what Josie has to say for us, to us.
Rise and shine, ilanga libalele. Rise and shine, lijaji lihlabi ile.
Wazi and I went back to school today. We were so excited to see each other, but we had to stay apart. We had to practice social distancing. That means at the entrance to school, we had to wait on the lines that were drawn on the ground. So we could not be next to each other. First, we had to sanitize our hands at the gate. We also had to have our temperature checked. Then we could go through the gate to our classroom, and we had to keep our masks on all day. We were very happy to be at school, even if it is a different and new way of being at school. We love school, and we love to be with each other.
So again, thank you everybody for coming. Stay tuned, more to come on Josie. We really hope you found today's seminar useful. Thank you very much for your participation, for your interest. And as I said, if you have questions that aren't answered, please check our community of practice and we will endeavor to answer all of them. Thank you all so much. Thank you.